Hello, this is Dr. Patrick Nemechek. I want to present to you our research that was presented at the 13th International Neuromodulation Conference in Edinburgh, Scotland, May of 2017. This presentation is on the reversal of chronic autonomic dysfunction utilizing transcutaneous vagal nerve stimulation as part of an anti-inflammatory regimen. We now know the brain is readily capable of recovering from injury. These injuries take the form of physical traumas, emotional traumas, inflammatory insults, as well as toxic exposures. The common minor traumatic brain injury, otherwise known as concussion, should be fully repaired within 2 weeks to maybe 3 months at the utmost. This happens through the damaged neuron being detected by a surveillance microglia. The microglia then morph into M1 and M2 formats, being to initiate the repair process, this being assisted with neurotropins, neuroprogenitor stem cells, and results in a repaired neuron. But unfortunately, the recovery is inconsistent and often results in autonomic dysfunction. Physical element that occurs from this is cerebral hypoperfusion and leads to the common clinical symptoms of headaches, neck pain, anxiety, poor cognition, altered balance, and chronic fatigue. Some of the main things that are involved in this, in our opinion, is the prime microglia, as well as the excessive production of pro-inflammatory cytokines from multiple sources. So we have LPS translocation from bacterial overgrowth in the small intestine leads to the permanent pro-inflammatory M1 microglia state. This, with every additional injury, causes a surge in pro-inflammatory cytokines within the CNS on the brain itself and magnifies the damage. These pro-inflammatory cytokines are also coming, though, from the periphery. They get through to the brain through the blood-brain barrier as well as paraventricular organs, and there's production in the CNS of pro-inflammatory cytokines from excessive exposure to linoleic acid and palmitic acid. The cytokines have an additional negative effect in preventing the function of neurotropins as well as the production and function of progenitor stem cells, all leading then to additional poor repair. So you end up with more damage, less repair. And this pattern was put forward by Cole Cunningham and his work with mice and vaccine stimulation. What we see here, so if you have a normal brain environment, you can get an injury, you'll have complete recovery. But what's happening is we have this primed microglia and the excess pro-inflammatory cytokines. What we are having is magnification of the damage with the injury and an incomplete recovery, leaving back a little bit of residual damage. As this happens over and over, that residual damage begins to accumulate, and now we end up with a thing called CBI, or cumulative brain injury. Our premise is that the excess pro-inflammatory cytokines inhibit normal neuronal repair mechanisms, and that suppression of cytokines will reactivate neuronal repair processes and restore autonomic functioning. So we developed the Nemechek protocol, which addresses cytokines from a variety of sources: bacterial translocation, the prime microglia, as I mentioned, the fatty acids, imbalance in production. It addresses the microglial dysfunction, stem cell problems, as well as neurotropin dysfunction. And briefly, it uses rifaximin to block further production of prime microglia, as well as production of cytokines through bacterial translocation in the gut. We use olive oil, which contains a large amount of oleic acid that it does an excellent job of blocking the toxic effects of linoleic and palmitic acids. And then we stop the production of cytokines from the M1 microglia through a combination of transcutaneous vagal nerve stimulation and DHA. On some of the more severe patients, we might even add curcumin. This, we're seeing, has the effect of halting this magnification of damage, and it also reactivates the repair mechanisms that allows neuronal repair. So what I'm going to show is a retrospective case series, patients in our practice. All the patients were included who underwent a baseline assessment, started the protocol, and then had another test within 2 to 4 months after initiating the protocol. We excluded any patient that had documentation of complete non-adherence to any single regimen of the treatment protocol. There were 76 subjects, equally distributed by gender, average age 64, but you can see some are 21 up to 79. I would like to add, here's our vagal nerve stimulator. This is a clip at the concha. It could also go across the tragus. And so we have the Nemechek protocol. The goal for transcutaneous stimulation is about 2 hours of cumulative dosing through the tragus or concha per day. There's a one-time, twice daily for 10-day course of rifaximin to clear excessive bacterial overgrowth. We have high-dose DHA, omega-3 supplementation, olive oil supplementation, alpha-linoleic acid supplementation through nuts or flax, and then all the patients received repeated autonomic spectral analysis every 2 to 3 months. We use a device from Ansar, the ANX 3.0, a very excellent device. It can give us both frequency and time domains of autonomic parasympathetic sympathetic function, and it will normalize these signals for the rate of breathing. Respirations can greatly alter these signals. In 17 minutes, you get a 5-minute seated rest, a 1-minute paced breathing, Valsalva challenge, and a 5-minute orthostatic challenge. We get some very, very good data. It only takes 17 minutes, and you don't require any specialized technicians. So what we found was an improvement in heart rate variability in our patients. We have both an improvement of sympathetic and parasympathetic resting function. The traditional sympatho-vagal balance kind of measures didn't show anything of significance here, but this is quite significant in what we saw in such a short time. And here's an example of the test results. This patient has low resting sympathetic and parasympathetic signaling, and then within just a few months we had recovery of that using this protocol. We also saw improvement of dynamic parasympathetic function. This was a reduction of excessive parasympathetic responses during the Valsalva and 5-minute postural challenge. There was some non-significant changes of sympathetic response, but the sympathetic changes are often obscured with parasympathetic excess states. And so here you see on Valsalva we have this reduction of this abnormally high parasympathetic response on Valsalva, as well as reduction of the same on the orthostatic challenge. Here during Valsalva you can see this excessive parasympathetic state within just a few months is now normalized. And here you can see there's a slight parasympathetic excess state. Now in this case we also had a deficient sympathetic response on stand, and both of these normalized within only 4 months. Conclusion: the Nemechek protocol, using transcutaneous vagal nerve stimulation as part of our regimen, improves chronic autonomic dysfunction within 2 to 4 months, improves resting heart rate variability, and improves dynamic parasympathetic function during Valsalva and 5-minute orthostatic challenge. It also improves symptoms in our patients in parallel with autonomic recovery. The state is not shown. We had improvement in lightheaded, dizzy sensations, headaches, chronic fatigue, anxiety, poor memory, and concentration. Often within 8 to 12 months of treatment, the patients would have complete normalization of all autonomic function and symptom resolution. One thing to view in a broader context for the future is that, as I mentioned at the beginning, these injuries are not just physical. You have the common physical concussions, but now we have cumulative brain injury being added to by emotional traumas or inflammatory traumas from surgery, fracture, or vaccinations. We've shown that Nemechek protocol can reverse chronic autonomic dysfunction, and we also have 2 presentations showing reversal of Alzheimer's dementia in 2 gentlemen, as well as complete reversal of PTSD in 2 soldiers. I think the Nemechek protocol utilizing vagus nerve stimulation could be very effective for other disorders. These all involve a inflammatory condition in the brain with primed microglia. We're looking at treating patients presently with Alzheimer's, macular D, as well as Lou Gehrig's disease and essential tremor. We have had a great deal of success treating patients with anxiety, chronic depression, bipolar disorders. Attention deficit disorders can be treated with this. And interestingly, we are having a great deal of success treating autism and other pervasive developmental disorders, all of which are being found to have a primed microglia state within the brain, chronic fatigue, and then migraine headaches. I'd like to thank you for this time to present this. Copies of my posters or presentations, I'd be glad to send you them if you just send me an email at the following email address. Thank you very much.